Asthma is a lower respiratory tract disease. It is an pulmonary obstructive disease and also called reactive airway disease. The pathogenesis of asthma primarily focuses on inflammation and airways hyperresponsiveness. When a person's airways become inflamed, they become sensitive, leading to swelling, mucus production, and bronchoconstriction. Exposure to trigger factors such as allergen, infections, or environmental factors exacerbates this inflammation and hyperresponsiveness, resulting in asthmatic symptoms like coughing, wheezing, and shortness of breath. And these symptoms vary and may vary in intensity from person to person. Now let's talk about the pathophysiology of asthma. Asthma involves complex interplay of various factors and it begins with the exposure to triggers such as allergens, irritants, or respiratory infections, which initiate an inflammatory response in the airways. And this inflammation leads to swelling of the airways lining and increased mucus production, while also attracting inflammatory cells like eosinophils, mast cells. Subsequently, the airways become hyper responsive to various stimuli, causing them to constrict more easily, leading to bronchoconstriction and further airflow obstruction. Over time, repeated inflammation and bronchoconstriction can lead to structural changes in the airways, such as thickening of the airway walls and increased smooth muscle mass, contributing to persistent airflow limitation and irreversible damage in the severe cases. Now, the types of asthma. There are five main types of asthma. Number one is seasonal asthma. Seasonal asthma is exactly that, when asthma symptoms occur during different times of the year, and this asthma is often due to the change in weather and can be triggered by different allergens such as trees, weeds, and grasses. Now, the second type of asthma is allergic. Allergic asthma is caused by allergen and is called allergic asthma. This type of asthma is triggered by allergens such as dust, molds, pollens, cockroaches, or pet denders. As it turns out, allergic asthma is the most common subcategory of the condition. And the third type of asthma is non-allergic. Non-allergic asthma is caused by different irritants we encounter in the air, like perfumes, fresh paint, wood smoke, tobacco smoke, and if you notice asthma symptoms that are not tied to allergen, then there is a chance it could be from an irritant that in the air. Fourth type is exercise induced asthma. It occurs because of the narrowing of the airways in the lungs during strenuous exercise. Suffering from exercise induced asthma does not mean you cannot remain active. Just be sure you take the necessary treatments when you exercise. And the last type is occupational asthma. Occupational asthma can be directly related to working environment, and some causes of occupational asthma that might be in working environment include chemicals, enzymes, metals, animal substances, and plant substances. Now, the symptoms of asthma. Asthma symptoms vary from person to person, and you may have infrequent asthma attacks, have symptoms only at certain times, such as when exercising, or have symptoms all the time. Asthma symptoms include shortness of breath, chest tightness or pain, wheezing when exhaling, which is a common sign of asthma in children, trouble sleeping caused by shortness of breath, and coughing or wheezing. Coughing or wheezing attacks that are worsened by respiratory virus such as cold or flu. Now, asthma triggers. Um, Exposure to various irritants and substances that trigger allergies can trigger signs and symptoms of asthma. Asthma triggers are different from person to person and can include airborne allergens such as pollen, dust mites, mold spores, pet denders, or particles of cockroach waste, respiratory infections such as common cold, physical activity, cold air, air pollutants, and irritants such as smoke, certain medications including beta blockers, aspirin, and non steroidal anti inflammatory drugs, strong emotions and stress, and gastroesophageal reflux disease is a condition in which stomach acid back up into throat. Now let's talk about the risk factors of asthma. A number of factors are thought to increase the chances of developing asthma. They include having a blood relative with asthma, such as parents or siblings, having another allergic condition such as atopic dermatitis, which causes red, itchy skin, or hay fever, which causes a runny nose, congestion, and itchy eyes, and being overweight, being a smoker, exposure to secondhand smoke, exposure to fumes or other types of pollution, exposure to occupational triggers such as chemicals used in farming, hairdressing, and manufacturing. Now, the asthma is classified into four general categories. Number one is mild intermittent. Mild intermittent symptoms up to 2 days a week and up to 2 nights a month. Second is mild persistent. Symptoms more than twice a week but no more than once in a single day. Third is moderate persistent. In this, symptoms once a day and more than one night a week. Fourth one is severe persistent. In this, symptoms throughout the days, on most days and frequently at night. Now the preventions. While there are no way to prevent asthma, but it can be uh, prevented by following different action plans. Get vaccinated for influenza and pneumonia. Identify and avoid asthma triggers like a number of outdoor allergens and irritants ranging from pollens and mold to cold air and air pollution can trigger asthma attacks. Monitor your breathing, like you may learn to recognize warning signs of an impending attack such as light coughing, wheezing, or shortness of breath. Take your medications as prescribed, like don't change your medication without first talking to your doctor. Even if your asthma seems to be improving, it's a good idea to bring your medication with you to each doctor visit. Now, asthma diagnosis is based on several factors, including a detailed medical history, a physical exam, symptoms, and overall health and test results. Number one is medical history and physical examination. First step in diagnosing asthma is to look for signs of asthma or allergies, wheezing, and a runny nose or swollen nasal passage, and allergic skin conditions. Second is spirometry. Spirometry, this test estimates the narrowing of bronchial tubes by checking how much air you can exhale after a deep breath and how fast you can breathe out. Third one is peak flow. A peak flow meter is a simple device that measures how hard you can breathe out. Lower than usual peak flow readings are a sign that your lungs may not be working as well and that your asthma may be getting worse. And the fourth is allergy test. Allergy skin tests are vital in finding out whether asthma is due to inhalant allergens. Drops of a number of allergens extract are placed on the skin, usually the forearm, and the skin is pricked lightly through the drops. Then a positive reaction will cause some itchy and a bump at the side within 10 minutes. Now let's discuss about the treatments. The bronchodilators are often considered, uh, while the other medications are considered. Like drug therapy depends on frequency and severity of drugs. Number one treatment for asthma is bronchodilators. Bronchodilator binds to the receptors in airway smooth muscle, thus causing bronchodilation. Second is anticholinergic agents. The mechanism of action for anticholinergic agents that decreases or blocks the action of acetylcholine on its parasympathetic nervous system receptors on smooth muscle cells. Acetylcholine is a neurotransmitter that contracts smooth muscles. Third is corticosteroids. The effect of inhaled corticosteroids is reduce airway inflammation and it suppress beta adrenergic receptor action on leukocytes. Fourth one is biological response modifiers. The effect of biologic response modifiers is the decreased frequency of allergic induced asthma. When the monoclonal antibody binds to IgE, interferes with mast cell binding, and this prevents mast cell degranulation and release of inflammatory mediators.